Hello, I'm Barbara Niles, and I'm very pleased to be here at today's meeting, the Stanford Conference on Evidence-Based Traditional Asian Medicine. This is such a great lineup here. I'm very pleased to be part of it. Thank you for inviting me. I'm going to talk today about evidence for mind-body interventions for post-traumatic stress disorder and do a little review and recommendations. So today's talk, I'm going to talk about what are mind-body treatments for PTSD, what is PTSD, a review of the current research, mostly reviewing randomized controlled trials on mind-body treatments, especially Tai Chi, and talk about a feasibility study we did for Tai Chi for PTSD, and then talk about some future recommendations. So I'm focusing this talk on post-traumatic stress disorder, or PTSD, because that's my area of research. I'm going to tell you first, what is PTSD? So PTSD, after people have been exposed to a traumatic event, they may have a series of symptoms. So the traumatic event could be all kinds of different things. War and war trauma is what I'm mostly studying at the National Center for PTSD as I work with veterans of wars, but sexual abuse and assaults and things like COVID-19 exposures, all kinds of things could be considered a traumatic event. So the first thing is exposure to a traumatic event. Next, intrusive symptoms. That would be memories, dreams, flashbacks, different things that intrude into people's day-to-day lives. Third, there's avoidance. So people don't like to think or talk about these things. It's also accompanied by negative alterations in cognition and mood. People don't feel good. And there's arousal and reactivity, irritability, sleep disturbance, poor concentration, those sorts of things. So exposure to a traumatic event, and then these 4 sets of what we call symptom clusters. The prevalence of PTSD it really varies depending on the population you're looking at. So in Europe, the population was estimated to be anywhere between 1% and 3%. That's the prevalence. The lifetime risk is higher, and in the US, the lifetime risk is 8.7% estimated to be, a little bit higher for men than for women. But if you go to populations that have been particularly exposed to traumatic events, such as being a war refugee living in Germany, that prevalence goes up to near 30%. US veterans following combat, that was about 23% for those who are seeking treatment. And recent studies have been showing that healthcare workers working in pandemic conditions are right up there too, 25 to 30%. PTSD is associated with a lot of other problems as well, associated with poor family relationships, unemployment, and income disparities. So people with PTSD just make less money. They have a harder time getting along in the world and frequently have suicidal ideation. One of the things that has become clearer and clearer to me over the course of my career is that PTSD affects the whole body. Recent research into the neurobiological correlates of PTSD indicate that there's an aging process that's accelerated for people with PTSD. See some of these people who have been suffering with PTSD for ages, and they look quite a bit older than their counterparts of the same age. PTSD is really now considered to be a systemic disorder that affects the whole body. There's a lot of health risks and health problems associated with post-traumatic stress disorder: cardiovascular disease, stroke, metabolic syndrome, Chronic pain is big. There's a big overlap between chronic pain and PTSD. Various types of cancer. That's just one example of ovarian cancer there. And importantly, PTSD is accompanied often by many poor health habits. So people with PTSD, maybe also depressed, don't necessarily take as good a care of themselves. There's higher rates of smoking, poor diets, and lack of exercise. So these things obviously can make all these problems above worse. But there is increasing evidence that it's not just the health habits that are causing these problems, but they certainly do make them worse. So the current treatments for PTSD are really what we would call talk therapy. I'm a psychologist and I believe in talk therapy, and I've done most of these treatments that are listed here. And I think they are very effective. And the research shows that they're more effective than most other things. So people who do trauma-focused treatment, where that usually involves talking or writing or thinking about the traumatic events they've gone through and coming up with new ways of thinking about these problems. They're quite effective, but they don't work for everybody. And for those who they do work for, many people still have residual symptoms. So the general rule of thumb is that they may work for about a third of people. In terms of a third of the people may have a significant reduction in symptoms so that they are no longer considered to have PTSD. A third of the people may get better, but or still have significant problems. And for a third of the people, it doesn't really work. And many people drop out of these treatments. They're hard to stay in. So I think it's important for us to also recognize that, as I was just saying, that PTSD affects the mind and the body. Metabolic syndrome is not something that is usually considered in treating of PTSD. And yet it's been noted that it's ripe for intervention because people with PTSD for years and years often get metabolic syndrome and many other problems. Clinicians are we in mental health care and in medical care really need to expand the repertoire of treatments for PTSD to target these things that are more health related, such as sleep, diet, and exercise. And I would say mind-body treatments are really needed for post-traumatic stress disorder. Mind-body interventions, as you know, because there are many of them showcased here, they really treat the whole person. They treat the mental health, the mind, by decreasing some of these symptoms of post-traumatic stress disorder, improving a sense of well-being, but they also treat the physical health, the body, the chronic pain that so frequently accompanies PTSD. They improve sleep, which is such a major problem for most people with PTSD. And furthermore, they improve other areas of health, such as flexibility, balance, and strength. NCCIH, which is the National Center for Complementary and Integrative Health, lists these as the main mind-body interventions that they're interested in looking at. So we've got yoga, chiropractic and osteopathic manipulation, meditation, massage therapy, acupuncture, which I know we're hearing about today, relaxation techniques. Tai Chi is what I'm going to be talking about some, and other things such as healing touch, hypnotherapy, and movement therapies. I also want to make a distinction between active treatments for active mind-body treatments and treatments that are not active. So in active mind-body treatments, the individuals going through the treatments take an active rather than a passive role. So the individuals do something rather than have something done to them. So people are doing yoga, doing Tai Chi, practicing mindfulness, rather than having massage therapy done to them, for example, as an alternative. These treatments have some advantages in that they can often be delivered in groups, which may make them more cost-effective. They can be practiced outside the clinic on their own. So, between sessions of Tai Chi or yoga, they can be practicing at home. And they're highly portable with a high potential for dissemination. So the active mind-body treatments of this list I gave you earlier include yoga, meditation, relaxation techniques, and Tai Chi, along with movement therapies. I'm particularly interested in these first four: yoga, meditation, relaxation, and Tai Chi as the most common mind-body treatments, active mind-body treatments. And there is a pretty picture to remind me and us all to take a nice breath since we're talking about mindfulness. And then moving on, I want to just describe a review that I did for a paper that we presented, just checking the time to make sure I don't go over. We did a systematic review of randomized controlled trials of mind-body treatments for PTSD. We really wanted to look at what is the empirical support, because there really wasn't much, but we wanted to pull together what there was. And as we're starting, embarking on a plan to use Tai Chi as a treatment for PTSD. So our aim was to summarize the published studies of mind-body treatments, and we limited that to randomized controlled trials, which are, the most rigorous of the kinds of clinical trials you can do. And we focused on the active mind-body treatments, as I mentioned before. So here is the paper that was published a few years ago, and where we reviewed the randomized control trials of active mind-body treatments, and we focused on meditation, yoga, relaxation, and Tai Chi. So I'll start with mindfulness meditation, and here's a few pictures of people doing it. You don't have to do it in this seated position like this. Many people do, and that's sort of the stereotypical thinking about mindfulness meditation, but there are lots of different ways to practice it. Just plain sitting without putting your hands up is also a very common way. So there were, when we did the review a few years back, there were 8 trials. There are now 11. So the ones in yellow are the ones that have been added since we did the review. And basically, they were all small trials, most of them small trials, and they showed that symptoms reduced in the mindfulness meditation conditions, not necessarily more than active treatments, but definitely more than weightless control. But some of the active treatments here, like presence-centered therapy, this Davis study, they didn't necessarily do better. This one, Nidich, 2018 here, was on transcendental meditation compared to prolonged exposure, which is one of the most prominent evidence-based treatments for PTSD. And that was a non-inferiority study that showed that transcendental meditation was non-inferior or just as good as prolonged exposure. So that was a surprise finding that many people who are tied to these talk therapies were surprised to see. The next one I'm going to talk about is yoga. And here are some examples of people doing yoga. As you can see, older people, younger people, it's made for all kinds of people. The evidence for yoga for PTSD is probably, of the mind-body therapies, is probably considered the strongest, even though most of these studies were small and the evidence is not very strong for it. But there definitely seemed to be people did get better and using yoga for PTSD. And this is considered preliminary evidence supporting the use of yoga in the treatment of PTSD. And finally, relaxation Interesting thing about relaxation, here are just some examples of people doing it sitting or lying down. The interesting thing about relaxation is that in every single one of these studies that I've got up here, relaxation was used as an alternative therapy to a therapy that people thought was was the target treatment for that study. So it was compared to things like exposure treatments, EMDR, which is eye movement desensitization and retraining. So in all of these studies, relaxation was just used as an alternative, almost like a placebo. People really did not expect it to do much. They were like, well, we'll compare what we think is our great treatment with relaxation. And the surprising thing is that the findings showed that in almost every case, relaxation was hardly any different. That people did get better. Some of these other treatments were slightly better, but not dramatically so. And that relaxation really was surprisingly helpful for people with PTSD. I think that's the take-home message for that. Okay, finally, getting to what I really want to talk about today, which is Tai Chi. I'm just going to talk a little bit about Tai Chi, although I'm guessing most of the people here know a little bit about Tai Chi. It's also called Tai Chi, Tai Chi Chuan, and also shadow boxing. And it is an ancient Chinese tradition, as many of you probably know. And it's a graceful form of physical activity. It's characterized by, I will say, 4 different types of things. One is the slow, graceful, low impact movements. And those are combined with range of motion exercises and balance training. There's a mental focus on body position and choreographed sequential forms, and deep diaphragmatic breathing and mindfulness relaxation. So, it includes many of the things that are also included in mindfulness. And it's closely related to Qigong. Qigong is, I think, generally considered very much like Tai Chi, except that it doesn't have the choreographed sequential form. So there's a lot of breathing exercises and slow, graceful movements, but not in this sort of choreographed or dance-like sequential forms. So there are some pictures of people doing Tai Chi. The one on the bottom is some veterans doing Tai Chi at a different VA facility than ours, but a nice picture. And I'm sure people have seen people doing Tai Chi out in the real world. So we're really interested in how many trials of Tai Chi for PTSD there were, and we're surprised to find that there were 0. None. So this looked like a really good area to investigate. The reason that I think it's a really good area to investigate is that there's a large body of evidence going back many years about the advantages of Tai Chi and what it can do in other areas besides post-traumatic stress disorder. So there are mental and physical health disorders or problems that Tai Chi has been shown to be very helpful for. So this is an evidence, this here is an evidence map that was done at a VA query, which is a big research program within the VA. And I'm just gonna go over this real briefly because it's kind of hard to see. But this was done back in 2014, but I thought it did a nice job of summarizing the evidence. So on the x-axis down here at the bottom, no effect, unclear evidence, or positive effect. And on the y-axis is the size of the literature. And in this case, it was the number of randomized controlled trials. And then each of these bubbles is the number of, it represents the number of systematic reviews in that area. So importantly, it seems like the most promising results as of 2014 were for Tai Chi for hypertension, fall prevention, and cognitive performance. So I think probably many of you have heard about the usefulness of Tai Chi for elderly people to help with fall prevention. And that's certainly been something that I think has been in the news quite a bit. But it's important to note that a lot of these studies were small, they were not randomized, they lacked control groups. They were really not methodologically very rigorous. There's also encouraging findings for osteoarthritis, COPD, that's chronic obstructive pulmonary disease, pain, balance, confidence, and depression. But this showcased both that there's a lot of interest in it and there is some evidence suggesting that it is good, but there's really a need for high quality research. So I was pleased to be able to get a call from Chen Wang, who's become one of our strong collaborators. She's at Tufts University and has done a number of seminal studies in the area of Tai Chi. And she was interested to see if we could see if this would also be working for veterans. So she had done a number of these studies, which are showcased here. So along with Chen and some other collaborators, we did a small feasibility study with 17 veterans and gave them just a taste of Tai Chi. So it really was just feasibility to find out if people would come, if the veterans would like it, if it was at all possible to pull off a Tai Chi intervention in the VA, which is a large system in the US. It's our largest medical system. So the initial findings are that people really liked it. Most people were very satisfied with it. And they really thought they would come back again. They really liked it. That was really all we were trying to find out, is would people show up and would they like it? And basically it was a yes and a yes. We also got a lot of quotes from people about their interest in it. So one person said, it's comfortable for everyone, no matter how young or old you are, no matter your condition of your body. One veteran said, I used the words warrior spirit because, you know, veterans and soldiers, something that's like martial arts is more in tune with the warrior spirit. A woman who had been the victim of a sexual assault in the military said, I'm hypervigilant, and there were actually people behind me, males behind me, and I was calm enough to do Tai Chi. Your stretching is done upright. There's no time when you're prone, so I like that. It makes a huge difference with sexual trauma. Like last week, I was the only female in the group, and normally I would just leave, but I was actually closing my eyes and everything. In terms of home practice, when I do it at home, it's relaxing, it helps. I was doing a half an hour in the morning, a half an hour in the afternoon, and a half an hour in the evenings. I was doing an hour and a half a day. Okay, so that was our star. He was our star. I can't say that everyone did that, but they did practice more than we thought they would. This was very well received. So our conclusions from this brief study were that people did perceive it to be a powerful intervention. We only had 4 sessions of, this was really just a taste, just to find out if they liked it, because 4 sessions would not be enough of Tai Chi to see any effects. The interventions are generally about 10 to 12 weeks, sometimes longer, and 2 or 3 times a week. So, you know, compared to 24 sessions, our 4 sessions, we didn't expect to see, and we didn't even evaluate whether people got better. We were looking at what they felt about it. They perceived it to be a powerful intervention. No restrictions on age or physical limitations. So people who were in pretty good shape did it, and people who were not in good shape at all. It was a particularly good fit for veterans. So being considered part of a martial art, people tended to really like Tai Chi as very much fitting with their veteran identity, their identity as a warrior. And this differentiated it from something like yoga, which I think is probably equally good for people, but maybe a harder sell, harder to get people interested in it. It was a particularly good fit also for sexual assault survivors. So at no time were they required to close their eyes, and no time was it really expected that they would close their eyes, although we did do occasionally some seated meditation where they were invited to close their eyes if they wanted to. But for many assault survivors or other people with PTSD, closing your eyes in a room of people is not something that feels very comfortable. So it was a particularly good fit for sexual assault survivors too, in that they were never lying down on the floor. And then importantly, we think there needs to be more research in this, and we're hoping that we will soon be doing that. We have a grant in that we're hoping will get funded and will allow us to continue with this research. I also wanted to go over some hypothesized pathways by which we think Tai Chi may impact PTSD. So we're just submitted a paper on this where we identified 6 different pathways that we think may be reasons why Tai Chi may be very helpful for people with PTSD. So on the left side here, neuroendocrine and immune functioning, we know that for people with PTSD, they have chronic inflammation, accelerated aging, premature mortality, all kinds of cardiovascular and metabolic problems. And we also know that the relevant effect of Tai Chi is that it reduces inflammation and physiologic reactivity, and it has benefits that are comparable to other types of aerobic exercise. So in this regard, I don't know that Tai Chi is any better than other types of exercise, but it is a form of exercise that helps all these things. Brain structure and functional connectivity. We know that in PTSD, there's structural atrophy and aberrant connectivity problems or patterns. In Tai Chi, there's evidence of neurogenesis and enhanced connectivity in the cognitive control network, which is an important one in PTSD. That's related to cognitive performance. There's diminished concentration and attention problems with cognitive performance. And we know that Tai Chi, from other studies of Tai Chi, enhances cognitive performance. Arousal and sleep, as I was saying, those are particular symptoms of PTSD. Hyperarousal and insomnia or sleep disorder are part of the syndrome of PTSD. And we know that Tai Chi increases relaxation and there are improvements in respiratory control and sleep. Deep breathing may help people with their sleep. Finally, not finally, because there's 2 more. There's body awareness. We know that for people with PTSD, they have dysregulated body awareness. They often have a heightened anxiety or sensitivity, or conversely, a diminished interoceptive awareness in a dissociative type. So they're very unaware of what their body's doing, or they're hyper aware to what their body's doing. And in Tai Chi, these can be normalized. There's neither exaggerated nor suppressed experience of body signals, and that may allow for enhanced self-regulation. So the idea is if people understand how their body is working and they feel themselves becoming triggered by something because they notice that their heart rate is accelerating, they can do some deep breathing or some Tai Chi, Qigong exercises to bring down their arousal symptoms. And finally, chronic pain. Chronic pain frequently accompanies PTSD, as I said, and there's a high prevalence of chronic pain in PTSD. There are a number of studies showing that in a variety of different areas, as I mentioned, our collaborator and colleague Chen Wang has shown Tai Chi to be very effective for knee osteoarthritis is just one example. Okay, so just to review what I said here, we've got mind-body treatments are more appealing for some people and associated with less stigma than talk therapy. They promote physical health and relieve psychological symptoms. They're feasible and acceptable for veterans with PTSD, sorry about that, and their efficacy rivals conventional talk therapy treatments. For future investigations, we think that the best ways, we want to look at the best ways to integrate mind-body treatments, particularly Tai Chi, with current talk therapies for PTSD. As I said, I'm a psychologist. I believe in talk therapies. I just think they're limited in certain ways. So are there ways we can bring these 2 things together? We also want to look at what's the optimal dose? What's the frequency and intensity of Tai Chi treatment that will be most helpful for PTSD? Of course, it's come up, accessibility. How are we going to deliver our Tai Chi interventions via telehealth? We're currently doing a Tai Chi intervention study for Gulf War illness, and we've switched over to doing it via telehealth through the computer like we're doing this conference. Also, I think it'll be important to do community classes because the community aspect and the social aspect of Tai Chi is something that's very important. And importantly, I think we really need studies on Tai Chi for PTSD treatment trials. I think I'm going over time here, so I'm just going to stop with saying thank you very much. I really appreciate your time and attention, and I look forward to talking with you at the conference. Thank you very much.